Brixton, the heartbeat of Black Britain and one of the most celebrated parts of the UK. It's also where I was born and raised. But there's an ugly and often tragic reality that extends across the country. And that's if you're a black man, you're around 10 times more likely than a white man to have experienced a psychotic disorder in the last year.
I think for me, exercise and physical activity was a big part of my recovery.
Eshe Egbonu has bipolar disorder. He's 27 and 3 years ago, his mental health reached crisis point.
There were certain things that I was doing that were erratic in terms of my behavior and very impulsive. So every emotion I'm feeling is heightened. So when I'm happy, I'm euphoric. When I'm angry or I feel that I've been aggrieved, then there's this type of energy that's bubbling up that needs to manifest somehow. And so that would lead to certain confrontations, whether they're at work or in the home situation, and tensions began to brew.
Eshe's mental state caused a breakdown in relations with his family. He says they had no choice but to call the authorities. He ended up being sectioned twice under the Mental Health Act. The second time he left hospital, but without permission.
Walked home thinking we can just move on and put this behind us, but a couple hours later, the police were called. They came to the household, knock, knock. And the first time I was compliant, but this time I was defiant. Officer said, you have to go back. And then there was the physical struggle. They tried to get me down. I wasn't having it. And so once that failed, the next course of action, of course, was the taser. 50,000 volts. The muscles just collapsed on the floor, back in the handcuffs, driving back to the hospital.
Eshe says he understands why he ended up being restrained, but it frustrates him that it had to get to that stage. Black people are 4 times more likely to be detained under the Mental Health Act, and all too often, that's their first encounter with the system.
The point at which they enter is at that point of crisis, at that point of emergency, which then reflects in the number of sections that are used. So what is happening before that is the key point.
These fears are something that psychotherapist Bafal Ababio hears too often. He works with black men and says there's a wider problem. As soon as black men enter the psychiatric services, more often than not, they receive the most extreme forms of treatment.
The treatment options, the section, and also heavy dosages of drugs, and being locked up in locked sections of hospitals and special hospitals, and physical treatments such as electroconvulsive therapy independently of their diagnosis.
He says the way black men are treated in the mental health system is a problem with historic roots. Among them are discrimination and deprivation. So too the impact of migration, generations of black men who didn't fully assimilate into a society many of them felt excluded from.
Good morning, Michael. How you doing?
Michael Flowers came to the UK from Jamaica over 50 years ago.
Clash of cultures, misunderstanding and fear as well. Fear of the black man.
Okay. What do you mean by fear of the black man?
It's like an inbuilt thing. It's something that I've experienced myself, growing up in the community from I come here in the 60s. Yeah. Like a man of my size and my stature, you know, feeling erratic and getting ill, and it would look like I'm being violent to someone that doesn't understand.
That lack of understanding and the disconnect and tension between the black community and the authorities, he says, made it impossible to reach out for help with his mental health.
Interacting with, I can say, the police, because to me at those times the police was representing the system. Sure. And to me, and it was difficult them time to even approach somebody in certain authorities to really express yourself.
It's only recently Michael has felt comfortable talking about his problems with depression. The big reason for that, he says, is attending this centre in Lambeth and being in a community of people who can identify with his struggles. Members are helped to build confidence and skills whilst getting support in a non-clinical setting.
And do you remember what it was that you were particularly struggling with?
Hearing voices that torments me. Sometimes get all these imaginative thoughts that always, it comes every day and it never stops. It just it's ongoing. Anyone can experience mental health problems. It's like it's a stigma that affects everyone personally, and it affects how they feel within themselves, how they interact, how they behave.
What is it about here at the clubhouse that works for so many people in this borough?
It's a good community where people can find work and volunteer in any work.
Around half the members here at the Mosaic Clubhouse are black. Reflecting the community is a key part of its success.
People come here and something sparks, something's familiar to them. So the staff are local people. The staff are all non-clinical people who've had interesting lives and done interesting things. So I think people just feel it's a community that they can fit into. It's human beings being kind to human beings. I don't know what it's like, obviously, to be a young black man, but I do know what it's like to hurt and to feel pain and to feel lonely and isolated.
The work on the ground within Lambeth is significant. Local councillor Jackie Dyer feels one of the key reasons black men are being failed is because members of the community aren't being involved in the decisions affecting them.
South Africa.
She's also an advisor to government and defiant that the only way the numbers will reduce is if those people most affected are involved.
You've got the same players making the same decisions about a people that they know nothing about, and so they are designing services, improving services, but at a distance away from those people. How are you going to reduce the numbers? The numbers won't reduce. How are you going to reduce the numbers of people that enter the system at a crisis point? You can't do that because actually the people are entering the system at the crisis point because they don't know how to access the system earlier. Primarily, a lot of the reason when it comes to the African and Caribbean communities, because they don't trust you. The narratives that are in the community about the mental health services, that when you enter that, you die.
Psychotherapy grew out of a sort of white middle-class European sort of environment and context. But as Britain became more diverse, psychotherapists then were forced to begin to deal with people who look different to them. You cannot really apply those same cultural ways of understanding the world to people who come from different contexts.
And we know we shall win.
And that is what the government has to change if it's serious about tackling the problem. The Prime Minister has commissioned a review into the Mental Health Act, acknowledging the disproportionately high numbers of black men being detained. But it's local communities that have taken the first step, recognising the need to take control of an issue that affects everyone.
Well, in response to that report, a spokesperson for South London and Maudsley NHS Foundation Trust told Channel 4 News that it is strongly committed to understanding the social and economic factors that impact upon black and minority ethnic communities and are providing services that are more responsive to their needs. Well, joining me now is Jackie Dyer, co-founder of Black Thrive, a partnership for black well-being, and Roger Smith of the Nubian Users Forum, a group that supports minorities with mental health needs. Let's talk about solutions for a few minutes, because that film laid out the problem very, very clearly. How do you make a health service that is predominantly white and Asian, in terms of the people delivering the service, sensitive and accessible for black men?
Well, first and foremost, let me just address that by saying that it's one of the most difficult tasks to actually do, because you've got a predominantly, as you said, a white area, and we're always in the minority. And secondly, as a black person, as you saw from your own film, you'll see that you're going to be marginalized and disenfranchised straight away. You don't have to say anything or do anything. Your complexion just says it all, and straight away they look at you as being the aggressor.
So how do you take away fear of the black man?
So the way you take away the fear is basically you have to empower them and let them know that, like, that's not the only way forward for them to be heavily medicated. You have to make sure that the system, like social services, doesn't allow anybody to actually be put back into the system, like through roving doors, and go back into hospital. They have to stay with their extended families, not go into foster care from when they're young and things like that, or get involved in any sort of gangs or anything like that.
Are there any examples of what works? How you make the system more sensitive?
I think that you have to look at the system as a whole. This is a systemic issue of unconscious bias and racism in terms of attitudes that manifest themselves in behaviour. And then you have to make sure that in each of these different arenas that are making decisions about what would best respond to black people in mental health crisis, that black people are actually involved in that process. So there are good examples of that kind of work taking place, having a systematic response to a systemic issue. In Lambeth, we are working both in terms of Black Thrive, working with system leaders from the police, from health, from education, from the leaders of the council, working with community leaders, community members, carers, service users, and people who are interested in this agenda, working in an equitable way to address and look at what are the solutions that are around prevention, what are the solutions that improve access, what are the solutions that improve the patient experience. So there are ways that we are doing that, and we're doing that working in collaboration, co-production, and partnership. It can be done.
I mean, we heard in the film that gentleman saying, you know, black people don't go for mental health help early because their attitude is if you go into the system, you die. I mean, how do you change that perception? How do you get people seeking help?
Well, it's one of the most hardest things to do once again, because they have lack of confidence in the police and in the system, because if you already have a stigma attached to you and a label, the only way you can combat that is to literally is to try and unite and say, well, if you have your own journeys and you try to get people into some kind of centre or whatever, if there is one. Unfortunately, there's lack of these centres. With the cuts and then what the things the government is doing, they have a very hard place to actually go to and actually do stuff about getting their support.
But are you saying black people don't go to their GP and say, I'm feeling terrible?
Even if they go
even
to
if
their
they do go to their GP.
Yeah,
even if they do go to their GP, I am saying exactly that, because the GP doesn't even really understand the prognosis. They're very quick to sort of just give you just some medication, but they don't really understand the demographics, because they don't suffer through mental health themselves too much, really. So
I think it's a different experience. The experience of African and Caribbean people within this country, as demonstrated by the Race Disparity Unit, is data, ethnicity figures, is that when you look right across the public sector, employment, housing, education, health, criminal justice system, our experience is one of being discriminated against that manifests in detention or exclusions. Our experience, and this is for decades and beyond decades because it's over hundreds of years, there's this dynamic of oppression that we experience. How can one expect any other manifestation other than crisis within our communities? Because what you have is system players that keep replicating.
But it needs to come from both ends, doesn't it?
But it needs to, in order to make those changes, you have to work with the people that are being oppressed, but the oppressors also need to work with those oppressed much more closely than ever they do. Normally the response is, oh, we've got a crisis, so let's look at the top-down answer, we can drop down on the people here. Actually, that does no longer work. You have to work together all along the way in a systematic kind of a way, and have the very difficult and absolutely quite frank conversations about how discrimination is undermining our ability to have good mental health and well-being in this country.
Roger?
We need to apply more action. I believe that action needs to be taking place. We can talk for hours and years and centuries at holistic remedies and attending various meetings at conferences, whether it's a foundation trust or Health Watch or any other things that we do in Camden and Islington, for example, per se. but we need to really apply action. We need to actually unite together as a family, as a unit within the community. But the thing that's broken is the trust between the services that you're actually trying to get the help from. So it's got to come from the top down, from managers, the directors, and they know who they are, they know what they need to do, but you try and get help from them. Like, for example, in the New Benitez Forum, that's one thing we have lack of. We don't have lack of, we have lack of funding, for one, to actually do the things of resources that we want to do to deliver the service that we need for our service users.
I'm sorry, we've got to leave it there, but thank you both very much indeed, Roger Smith and Jackie Dyer. If you have any concerns about the issues raised in our film and that discussion, there's a website you can access for more details. That's channel4.com/support.